Newborns can do some really weird things, and it can freak parents out. So let's go over some common newborn things that I see as a pediatrician, what is normal, and what could be concerning. A quick reminder before we get started, this information is for educational purposes only. It's not medical advice. So you can use this information to feel confident and informed when you have a conversation with your doctor. But in terms of how it's applied to your child, always loop your doctor in and have that conversation about what is right personally for your situation. My name is Dr. Heather. I'm a board-certified pediatrician and founder of PedsParent Network, where I want to help you to feel more informed, confident, and prepared as a parent as you navigate healthcare settings. Let's get started with one of the most worrisome things that parents come in about: newborn breathing. Number 10, periodic breathing. So as you can see from this video, there is a rapid, shallow type of breathing pattern that you can see in the baby, and then eventually take a deep breath, and then that pattern resets. They might go back into that rapid, shallow breathing again, and they might do that for a few cycles. And when you really start looking at your baby and paying attention to their breathing, it can look kind of weird and be worrisome to parents. We may see this more often as babies are sleeping, but it could happen at any time. We have that deep breath, and then the breathing does calm down. So some of the things that you want to look for to make sure that it's not a more worrisome breathing pattern would be if the baby has a persistent rapid breathing, particularly over 60 breaths per minute. That would be something that definitely warrants getting checked out. Also, some signs of distress might be when you see the ribs kind of suck in right under at the bottom of the rib cage, as well as you might see that in the collarbone area. And another sign would be nasal flaring. So if you're not sure, if you're worried, always check in with your pediatrician, find out what they think about your baby's individual situation. But if this does fit that periodic breathing pattern, that's just your baby trying to transition from inside the womb to outside life. Typically, we don't see this pattern of breathing continue more than beyond 3 to 6 months. It's pretty unusual beyond that point. Now, some babies who are born prematurely might have a more extended period of time that they can have this periodic breathing, but usually it should go away by then. Next on our list, number 9, blue hands and feet. So this is something that comes up quite a bit. Parents get worried about the bluish discoloration, of course, in their child. And they'll usually mention that they're just seeing a blue or purplish hue to their hands and their feet. The medical term for this is called acrocyanosis, and it is completely normal. Immature circulation in a new baby being prioritized towards the internal organs, the heart, the lungs, everything more centrally. And so because of that, we may see this blue or purple discoloration in the hands and feet. Now, things that help us to distinguish this versus something concerning are the fact that we're seeing it symmetrical, so both sides that you see it on, both hands, both feet. It should not be associated with any type of signs of distress or discomfort or trouble breathing. Before we continue, we still have 8 more to go. But make sure to hit that subscribe button to follow along with more pediatric health education for family. Next up is number 8. Frequent sneezing. It's not typical for kids that are this young to develop allergies. Babies can't blow their nose, so this is their way of clearing out their nasal passage naturally if anything like a little milk or dust or something gets stuck up there. If there is any nasal congestion or runny nose, that's definitely something you want to run by your doctor, as well as, of course, if there's any feeding concerns, if they are acting really lethargic to you, if they have a cough. Those are all things that we want to rule out other causes for the sneezing. But usually the sneezing will improve on its own if it's just the normal newborn sneezing, typically after the first few months. Number 7 is frequent hiccups. As inside your womb, you may have felt those hiccups a lot, and after babies are born, they will hiccup quite a bit as well. Hiccups are a reflex, and they happen when the diaphragm, which is a muscle that controls breathing, contracts suddenly. After birth, feeding coordination, digestion, and the nervous system maturing are all factors that cause babies to have more hiccups. Some of the common triggers for hiccups might be feeding quickly, getting a lot of gas, or a full belly, or stretching. You can't always prevent hiccups, but some of the things that you can do, make sure that you're burping between feeds. You can try to pace the feeding so that you're avoiding overfeeding, checking the bottle flow or latch, and making sure that you gently prop babies up briefly after feeds when you're burping them. Hiccups are associated with poor feeding, poor weight gain, reflux or vomiting, or concerns for back arching and fussiness with the feeds. Then those can be potentially concerning signs that should be discussed with a doctor. Okay, so we got to number 6, which is the umbilical cord stump. So after birth, that beautiful connection that baby had to mom becomes this dried, shriveled up stump that can fall off typically between 1 to 2 weeks old. When you're coming in for your newborn checkups, these are things that the doctor will be assessing. And if there is any concern about the healing process with the umbilical cord, then sometimes we will apply a little treatment on a stick. It's called silver nitrate, and it just helps to dry that area up at the base of the umbilical stump so that we can make sure that it heals easier and doesn't cause any prolonged type of infection. After it falls off, then usually regular baths are fine. Number 5 is a newborn rash called erythema toxicum. I know that that name sounds horrible. So every time I tell a parent that that's what their child has, I have to preface that by saying, don't worry, it's going to be okay. This is a common rash. Crazy name, erythema toxicum. But most babies get this to some degree. Within the first few days after birth, you might start to notice these little red bumps in different spots on the body. They're kind of scattered out. They will look red, raised, sometimes almost pimple-like with a yellowish little pustule in the center of it. And then you can see that go over the whole body sometimes, or sometimes you might just see a few here and there. And they can come up over about 1 to 2 weeks, and then they all just magically disappear. So they are not thought to be related to infection or an allergy. Things that are not typical would be if there is oozing, if there is poor feeding, any fever, or a baby who's not looking well. And next up is number 4, baby acne. So this is another type of bumpy rash that looks more like acne or pimples that you might see in a teen or an older child, but it's coming up in your newborn, and it may start within a few weeks after birth and last for a few months potentially. In many cases, this is just a newborn, again, adjusting to life outside the womb, the hormonal changes that happen, and sensitive oil glands that can all kind of combine and cause this as an issue. So we don't recommend scrubbing them, picking at them, using any acne type of products on a baby's skin. These are bumps that are going to go away most of the time on their own. And so just using gentle soaps that are unscented and lotions that are unscented are fine to moisturize your baby's face, but typically we don't recommend doing anything else. If the bumps are lasting for a few months, if they seem painful, if they're oozing, or any concerns that you have as a parent, you want to discuss with your doctor, and they can help give you guidance on what the best steps are. Okay, so 3 is peeling skin. This definitely is something that we see all the time and parents are worried about. And you might notice peeling and flaking and just very dry looking skin that can happen right after birth to weeks after birth. Before birth, your baby was surrounded by fluid and had a protective coating called vernix, which helped to keep the skin moisturized. After birth, they're adjusting to dry air, the environment, bathing, clothing, and all of that can lead to that peeling dry skin. Please don't pick or peel the flaking off. And there's no specific lotions that you necessarily need to apply to the skin. It will improve on its own. And avoiding overbathing can help because it can actually dry the skin out more. So typically just a few baths a week are fine for a new baby. I usually tell parents that if they're seeing flaking or peeling to the point where there's some cracks in the skin and they're worried about it, it is okay usually to put some Vaseline on that area just to help moisturize it. So some of the things that could be concerning would be if there's excessive peeling, if there is a lot of redness, oozing, cracking, bleeding. And next on our list is number 2, Epstein Pearls. We will see these in babies when they open their mouth really big, and you can just see this little white bump on the roof of their mouth, and parents get concerned about what that might be. I actually see it on most babies. It's very common, and it's just a little type of cyst. So Epstein Pearls are harmless cysts, and they form when the mouth is forming and a little bit of tissue gets trapped underneath the roof of the mouth. Some parents worry, is that thrush? Is that a tooth or something else? But those isolated little white bumps are usually not anything concerning. Please do not try to pop them or scrape them or take them out in any way that is not necessary and can definitely lead to irritation or problems. And typically these bumps should not affect a baby at all in terms of feeding or causing any pain. So that would be uncommon or concerning because that does not really fit the picture of just these benign Epstein pearls. Okay, so we made it to number 1 on our list, baby breast buds. You might notice small little lumps of breast tissue, and it could be on one side or both sides, and it can happen in girls or boys. And this is usually due to hormone exposure related to pregnancy and after pregnancy, even with breastfeeding. We want to avoid pressing on or squeezing in that area, trying to get out any milk or fluid that's there because that can lead to irritation and potentially infection. So just leave it alone. If there is pain, if there is any concern that it's rapidly growing in size, looking very red or warm to the touch, those are all possibly concerning signs that should be checked out. Just to recap, these are 10 things that babies do that freak parents out, but there are so many more. If there's others that you want to hear about, put that down in the comments and I'd be happy to cover more weird newborn things. If you want to feel more prepared when you go to the doctor, especially in the chaos of having a new baby and not getting a lot of sleep, I've put together a free guide that helps to keep track of symptoms, concerns, feeding schedules, and things that you might need when you go to the appointment to hopefully feel like you're prepared and ready for doctor visits to get the most out of it. And if you found this helpful, please subscribe to PedsParent Network for more pediatric health education.